Welcome to the training module on behavioral services. In this training, you will learn about behavioral supports available to individuals through their DDD budget. We will review how to make a referral for behavior supports, NJ-CAT scores, and acuity factors related to behaviors, and what a behavior plan is. We will discuss the role of the support coordinator in addressing and monitoring behavioral needs, and the role of the DDD resource team and how to make a referral. This module will also cover the relation of behavior to the employment pathway, the mental health pre-screening checklist, and behavioral services available through the individual's HMO. Behavior supports are described as individual and/or group counseling, behavioral interventions, diagnostic evaluations or consultations related to the individual's developmental disability, and necessary for the individual to acquire or maintain appropriate interactions with others. Behavioral supports includes a complete assessment of the challenging behavior, development of a structured behavioral modification plan, implementation of the plan, ongoing training and supervision of caregivers and behavioral aides, and periodic reassessment of the plan. It is important to note that behavioral support services are offered in addition to and do not replace treatment services for behavioral health conditions that can be accessed through the state plan, MBHO, and mental health service system. Individuals with co-occurring diagnoses of developmental disabilities and mental health conditions shall have identified needs met by each of the appropriate systems without duplication, but with coordination to obtain the best outcome for the individual. Under the DDD budget, behavioral services are broken down into two components of billable services. The first is assessment plan development, and the second is monitoring. Assessment and plan development activities may include the following: behavioral assessment, development of a behavior support plan, dissemination of the plan, initial training and supervision of caregivers, training, oversight, and coordination with staff performing monitoring activities, periodic retraining and supervision of caregivers, review of raw and/or aggregated data associated with the plan, periodic reassessment of the behavioral support plan and revision of the plan when required. Monitoring activities may include monitoring the implementation of plan by caregivers, incidental correction and retraining of caregivers, and review of data collection practices for integrity. The two services may be offered concurrently to allow the provider to conduct their assessment, collect data, and establish or revise the behavior plan while they monitor the implementation of the behavior plan and provide ongoing training to caregivers and staff. The need for behavior supports will typically be identified through the New Jersey Comprehensive Assessment Tool and the Person-Centered Planning process documented in the Person-Centered Planning tool. Once this need is identified, an outcome related to the result expected through participation in behavioral supports will be included in the individual service plan, and the behavioral supports provider will develop strategies to assist the individual in reaching the desired outcome. Individuals and families are encouraged to include the behavioral supports provider in the planning process to assist with identifying and developing applicable outcomes. Once the need for behavior supports is determined by the planning team, the support coordinator will make referrals to providers that can provide this service in the individual's location and coordinate meet and greets with the provider and individual. Providers can be found on the DDD Provider Search database. The behavioral supports provider can request referral information that will assist the provider in offering quality services. The support coordinator will provide any pertinent information such as the ISP, PCPT, or previous behavior plans and evaluations. After researching providers, the individual will choose a provider agency. Once the support coordinator has informed the provider that the individual has selected them to provide behavioral supports, the provider has 5 working days to contact the individual and/or support coordinator to express interest in delivering services. The provider will inform the support coordinator of the service hours, duration, and frequency which will be added to the ISP, and once approved, a copy of the approved ISP and service detail report will be provided to the identified service provider. It is important for the support coordinator to review the NJCAT behavior section and ensure that the behaviors indicated on the NJCAT are entered into the behavior section of the ISP and explained thoroughly. The behavior itself should be described in detail, including what triggers it, how often it happens, and what calms the person down or prevents a behavior from occurring. In the ISP, there are various drop-down selections a support coordinator can make when entering behaviors in the ISP. The support coordinator should enter the behavior under the appropriate drop-down and describe the behavior in that section. Here you see examples of the drop-down selections in the ISP. They include descriptions of aggression, the specific behaviors, interactions with other, and any sensory issues. An individual that is determined to have a clinical level of need by completion of the NJCAT may be assigned the acuity factor for behavioral or medical needs. You will see this on iRecord indicated with the A after a person's tier level, for example, EA. Looking at the NJCAT scores will indicate whether the acuity is for behavioral, medical, or both. If the individual is assigned the acuity differentiated factor, behavioral supports cannot be claimed while providing the following services because those supports are already included within the rate. These services include community-based and individual supports, dehabilitation, and out-of-home overnight respite. When an individual has been assigned the acuity differentiated factor, the support coordinator must complete the support coordinator section of the Addressing Enhanced Needs Form, Appendix D, to indicate to the best of his or her knowledge the areas that need to be supported by the service provider when the individual is receiving their services. This information will be based on the support coordinator's review of the NJCAT and will be submitted to the service provider as part of the process to determine individual and provider compatibility and to assist the provider in understanding the individual's behavioral or medical needs. The service provider must complete the service provider section of the Addressing Enhanced Needs form to communicate how they plan to provide the clinical level of support to ensure the individual's safety. This form is first completed prior to service delivery, but can be revised as the provider learns more about the individual. Copies of the completed form will be uploaded to iRecord by the support coordinator, kept in the individual file maintained by the service provider, and revised as necessary. When an individual is assigned the acuity differentiated factor, it is presumed that medical and/or behavioral staff will need to be provided during service delivery. Behavior support plan means a comprehensive, individualized procedural plan of specific actions to be taken in advance of and/or subsequent to the occurrence of a target behavior, the purpose of which is to modify the frequency, duration, and/or intensity of the target behavior, facilitate alternative positive behaviors, and, as needed, to identify safety mechanisms to be utilized to protect the individual and others from harm. Positive behavior support, or PBS, is an evidence-based practice for addressing issues of problem behavior. It is an effective strategy in providing behavior support to persons with intellectual or developmental disabilities. PBS is a problem-solving approach that focuses on reducing the frequency of challenging behaviors and improving the quality of life for individuals. The term is often associated with techniques based on a systematic approach to understanding why a behavior makes sense to the individual, and the use of interventions that focus on changing antecedents in order to prevent problem behaviors, rather than relying solely on manipulating consequences to manage behavior. This approach utilizes techniques such as functional behavior assessment to identify the purpose of behavior and to help teams select interventions and individualize supports. Three examples of positive behavior support are shown here with the example of ordering lunch. It is broken down into three tiers. Tier 1, universal prevention, is for everyone. This strategy would be used to help anyone feel comfortable ordering lunch, not necessarily someone who is struggling in this area. Examples of strategies include finding a menu that includes pictures of food, finding signs that clearly indicate where and how to order, going to lunch nearby with friends, and having others order first as an example. Tier 2 is for individuals at risk. This strategy would be used for someone who is anxious or nervous about ordering lunch. To help someone with this, strategies could include practicing ordering lunch before arriving at the restaurant, minimizing noise by sitting away from children's play areas, engaging in deep breathing to manage anxiety about ordering, and using an online menu on a smartphone as a reminder while waiting. Tier 3 includes the most intensive supports, which would be used for someone who has repeatedly struggled with ordering lunch in the past. Strategies include conducting an assessment of challenging times, arriving before 11 a.m. or after 2 p.m. to minimize the wait time to order, listening to music while waiting, and creating a support plan using strategies that address the person's need. The role of the support coordinator in terms of behavioral supports includes understanding what is needed to minimize risks of dangerous behavior. This could include a safe environment, access to needed services, frequent communication and positive interactions with others, culturally sensitive treatment, opportunity for the development of appropriate social, communication, and other life skills, meaningful participation in the community, and appropriate treatment for medical conditions and mental health issues. The support coordinator's role also includes identifying behavioral challenges and needs during monthly monitoring, annual ISP meetings, and IDT meetings as needed, understanding mechanical and chemical restraints, which are explained in the next slides, and understanding positive behavior supports. Mechanical restraints are devices such as bed rails, mitts, jumpsuits, arm splints, vests, and helmets and body harnesses, which may be used as either a mechanical restraint or safeguarding equipment, depending on the circumstances. For example, a helmet to prevent injury due to seizures is a safeguarding device. Use of a helmet to prevent injury due to self-injurious behavior is considered a mechanical restraint. Mechanical restraints are considered to be appropriate when absolutely necessary, and their use should be minimized in favor of other, more positive interventions. They should not be relied on as a primary technique to decrease undesirable behavior. Continued observation by staff is required to recognize signs of physical distress, and devices must only be applied by staff who are trained in the use of the device. The need for a particular device must be documented in the service plan and reevaluated no less than annually as part of the service plan review or as needed by the interdisciplinary team. A chemical restraint may be used when an individual presents a danger to the individual or others in his or her immediate environment and when alternative, less restrictive intervention techniques have failed to limit or control the behavior. A chemical restraint is prohibited except for the administration of drugs ordered by a licensed physician on an emergency basis. A chemical restraint may only be used in an emergency. The DDD resource team is available to provide support to staff and families, assist with implementation of doctor's orders, and provide workshops. A referral form and instructions can be found on the division website listed here. Submit completed referrals and upload a copy into iRecord. A referral for consult by a behaviorist may be made for assistance to the behaviorist employed by the residential or day service to help with behavior support plans. Additional available training includes training on behavior support plans, behavioral supports, and PICA. The employment pathway allows a selection to be made for individuals who are unemployed due to behavioral challenges that prevent them from working. In these cases, the support coordinator should select Path 4, Unemployed Not Pursuing. This path is selected only if the individual will not currently be pursuing employment due to a medical or behavioral issue precluding the individual from working at this time due to substantiated concerns about harm to self or others which cannot be appropriately mitigated by supports and services. The specific behaviors and reason as to why they prevent the person from working must be explained in this section, as well as what the person will be doing to work toward being able to pursue employment in the future. The mental health pre-screening checklist is completed by the support coordinator annually with input from the individual's team. In addition to being completed with an annual plan, the checklist must also be completed if there are any mental health or behavioral changes with the individual at any time. The questions on the pre-screening checklist are used as a guide to discussion with the individual about any possible indicators that a mental health evaluation may be necessary. The support coordinator must add any information gathered from the pre-screening into the Safety and Supports Needs section regarding behavior needs, as well as the behavior section of the ISP. Finally, it is important to note that every individual receiving division services must be eligible for Medicaid and, as such, should have a managed care organization, MCO, designated to provide services related to his or her acute and behavioral health care needs. The MCO must assign a care manager to all individuals with developmental disabilities. The support coordinator should identify and reach out to contact the MCO care manager to ensure coordination of health care. Some services that an individual may be eligible for through the MCO include outpatient mental health services, partial care, partial hospitalization, or acute partial hospitalization services, adult mental health rehabilitation, and inpatient mental health services. This concludes our module on behavioral support services. Please refer to section 17 of the program manuals for further information.